Hello. Have you often felt that your chin or your jawline isn't strong enough and you were thinking about changing it, maybe making it better, but you weren't sure how to go about it or what you could do? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery. And today we are going to talk about chin augmentation, what it is, how is it done, what are your options. So firstly, what is chin augmentation? Chin augmentation is the name given for the procedure to make your chin and jawline more stronger, more well defined. Now, why is this done? Why do people want this? Traditionally, a strong chin and a strong jawline is something that's associated with someone being assertive, with someone being dominant, with someone having a forceful personality. And a chin that is not so strong, that is more blended into the jawline and into the neck, is associated with someone not being so forceful. It's associated with someone being a little bit more timid, a little bit more shy, a little bit more introverted. So these are some reasons why people look to augment their chin and enhance their chin. Particularly in males, this is requested a lot because they want to have that kind of dominant air about them. And in women, they want it to match the rest of their face. Oftentimes, a very rounded face is credited as being a little bit babyish or a little bit young, and they want to have a little bit more mature look. Another thing is that in the face, everything is judged in proportion to one another. Facial aesthetics is all about proportions. The nose is judged in relation to the chin. The eyes are judged in relation to the rest of the face. So this is why changing one part of your face can make a big difference in other parts. The most classic example for this is with rhinoplasty. If someone has a very large nose and they're looking to reduce it, it's not just about reducing the nose, it's about bringing the face in balance. Oftentimes, a nose looks larger if the chin is a little bit retruded and a little bit smaller. So simply by making the chin a little bit bigger, you improve the aesthetics of the face and the nose doesn't look as big. This is why chin augmentation is a common surgery that is done along with the rhinoplasty. Now, what are the options for chin augmentation? Simply put, there are three. The first one is fillers, the second one is fat grafting, and the third one is implant. Now, what are these options? How do they work? Well, fillers is the procedure wherein you are using a non-surgical method to augment the chin. A filler is a jelly-like substance that comes in the syringe, and you use the syringe to inject the filler. It fills, that's why it's called a filler. And with that, you can fill out the chin and the jawline and give the shape that you want. Next option is fat grafting. Fat grafting is a minor surgery wherein instead of a filler, which is an artificial material, you're taking fat from another part of the body, usually the tummy, and you're injecting that. So this is a minor surgery that is done under local anesthesia. It is done as a daycare procedure. The third option is to use an implant, which is where instead of using a jelly-like material, you're using an actual solid implant. This is inserted into your chin. It can be done from inside the mouth or outside the mouth. The implant is permanent and long-lasting. This is a surgery that is done under general anesthesia. Now, what are the pros and cons of each of these techniques? Let us have a look at them. Our first technique is fillers. You can see an example of a result with filler over here. Now, the advantage with fillers is that it is not a surgery. You come, get it done, go back the same day, immediately, and you can be back to your work. There is no downtime. The disadvantage is that it is temporary. The filler goes away within 1 year and it would have to be repeated. Our second option is the fat grafting. This is somewhere in between a non-surgical treatment like the filler and a full surgery like an implant. So you're trying to get the best of both worlds. The advantage here is that it is quite value for money. You're not paying for an implant and you can put as much fat as you needed. You're not paying per syringe like you do with the filler. The disadvantage is that it's a little bit unpredictable compared to the other two. The result depends on how much fat survives. Now, usually this is predictable, but in some people not enough fat might survive, so you might feel like you require a touch-up procedure. The other disadvantage is that it doesn't feel as hard as an implant. So you can see some results of fat grafting surgery over here. Now, the third option is a chin implant. This is where you're putting a artificial implant made out of silicone and you're putting it either from inside the mouth or outside. The biggest advantage here is that it is very long lasting. The implant lasts for a very long time. The other advantage is that it looks the best out of the three because the implant is the hardest material. It mimics the feeling of the bone. So in terms of result, this gives you the best result. The disadvantage is that it is a comparatively more major surgery as it has to be done under general anesthesia, and you would also have to pay for the cost of the implant, which costs more than compared to the other two techniques. You can see some results of an implant over here. Now the last question, and probably the most important question, is what technique do you choose? Which one is right for you? Well, quite simply, there is no one right answer. It depends on what that patient wants. That's why there are three techniques. Each one of them have their own pros and cons. So simply put, if you are against surgery, you do not want any surgical procedure no matter what, then fillers are your best choice. If you are not looking for a very large augmentation, you're looking for a mild augmentation, but you want it to be more long lasting than a filler, then fat grafting would be your best choice. If you're looking for a significant augmentation, a really large augmentation, and you want the result to be really long lasting, you do not want any kind of ups and downs or doubts, then implant is your best choice. So it depends on the patient. It is good to have options and you can think about it and choose which option works for you the best. So what is the downtime for each of these techniques? With the filler, there is no downtime. You are back to work immediately and there's no need to take any time off. Not many complications of filler. There might cause a little bit of a bruise, nothing else. With fat grafting, you can have a little bit of downtime for a couple of days. There can be a little bit of swelling which takes a little time to go down. Some people may get a bruise. With an implant, it's a general anesthesia surgery. You are sent home the same day. It's done as a daycare surgery. There can be some swelling and some numbness for a few days until you adjust to it. Infection is a complication that can happen with an implant. It is very rare, but if it does happen, then the implant would have to come out. So this gives you an idea of the time needed for recovery with each of these techniques. I hope this video was informative and you were able to understand a little bit more about chin augmentation. If you have any doubts, do feel free to write in to us or contact us. Our details will be coming on screen shortly. It is in the description below. Do subscribe to our channel and click the bell icon to get notified about new videos. If you have any questions or suggestions for other videos, leave them in the comments. Thank you. Have a great day.